Despite the upheaval that the pandemic has caused, it doesn't stop our give to our community. So this year, because of the pandemic, we still wanted to be able to give back. And what we did was we chose an organization that has been serving during this pandemic, which is our local frontline nurses. And this hit home really close to me and one of our fellow franchisees, Fran, because our mothers were nurses. And so we wanted to give back to an organization that basically has served and is still serving during this pandemic.
Vincent DeJesus was 39 years old. He spent his final days battling the virus at Sunrise Hospital, the same place he's been helping patients for 3 years. Those who know him say it's a career he had made his entire life.
He was our guardian angel, the family, the friends.
Vincent's parents were both in the medical field. He followed their legacy and decided to do it in Las Vegas.
He loved Las Vegas. He thought this was the greatest city ever, even though I tried to tell him that there were other places.
I'm very thrilled that Massage Envy partnered with us in honoring our nurse frontliners. I have been a nurse in the front lines before, although now I'm in the office. It's very difficult, to finish a 12-hour shift, turning patients, all that stress, not only physically, but also the mental stress of COVID. Massage Envy giving us those massages to honor these nurses, the heroes of our time, is really exciting. This year has been proclaimed by the World Health Organization as Year of the Nurse. And so true, you see all the nurses that are fighting every day for their patients and for our community.
So currently COVID-19 has changed my work routine drastically. Every second I'm at work, I am dealing with COVID. We are calling hospitals, getting reports on patients that were positive. We currently are making sure the firefighters treat every single patient like they are COVID positive, which is very difficult in this time, especially in the summer. And these guys are used to running into houses and helping people, and now they have to take a second, think about it, and treat every patient like they have it. We definitely don't want them taking it home to their family and their children. So it is 100% of my job right now, keeping them COVID free and educating them on what to put on, how to keep themselves safe. It's a big challenge every single day because they're scared. All of them are scared. They don't want to take it home. They don't want to get sick.
As part of my daily work, I do examine, diagnose, and treat patients. And I think I got the infection, the COVID infection, back early in February when a patient came to me from South Korea and complaining of sore throat and shortness of breath. So 4 days after I was exposed to him, I was having symptoms, which the same thing. I started having sore throat and no fever, no shortness of breath, but I was coughing really hard. And so I took off a week after that. My symptoms had been ongoing for probably 3 weeks before I got tested. Remember, it was early on the COVID infection when I was exposed to this patient. So finally, I was tested and I was admitted at UMC for a week. As soon as I got back, my husband started complaining of cough and shortness of breath. So I said, go to the quick care right away because I know I probably exposed him to me already. So he went and they found out that his oxygen was very low at that time. He didn't get to go home. He went straight to the emergency room and he was admitted for 2 weeks at UMC. And actually he was in the ICU. Fortunately, he didn't have to have the intubation. He didn't get intubated. He did really well. And my daughter also started not feeling well. So her presentation was more of allergies. And but I said, because me and Daddy already had positive tests, you might as well go. and she went and she was positive also.
My mom's definitely seen a lot of changes in the system and everything. Granted, I mean, she was back in DC when we lived there. She was supervisor for a hospital during H1N1 and everything, so she's used to it, but a lot has changed. I mean, it's definitely a scary time, and I definitely worry about her all the time because she's right there in the front line, but I wouldn't have it anyway because I know she's awesome at what she does. So
some results that I want to see from this is the community being more involved together, corporations doing more outreach. You know, with us doing something like this with the Nurse Association, we're giving them time to relax and we're paying them back for all the hard work that they're doing for us. So I would love to see more corporations being involved like how we are.
Thank you to all the essential workers and the hard workers out there, the front lines. Thank you for taking care of our community, and just let you know I'm here for you. I'm here to help you relax and help you de-stress, and I can be that calming grace in the storm for you.
To the nurses, I'm not a frontliner, and you are basically the heroes of this pandemic. To me, you are the soul and heart of the cure for this pandemic. My hat's off to you. My message to you is please, please protect yourselves. Please protect yourselves, wear your maximum PPE, and just be aware of your surroundings to protect you, because without you guys, we're not gonna survive this.
And we want to give a massive thank you to all of those that donated, from our teams at Massage Envy to our members and our guests. We could not have reached this goal without you. We raised over 1,200 massage services to give to our frontline nurses, and that was equivalent to over $140,000 in donations. So again, thank you so much for all of you who donated, and I just want to let you guys know that we are Vegas strong because we are all in this together.
We are Vegas strong.
Because we are all in this together.